Crowley, seca's Professional Affiliations and Education Manager, and I'm here with Dr. Michelle Alencar from inHealth Lifestyle Therapeutics. I'm so excited to have you join me today, and I wanted to give you a chance to tell us a little bit about your background and how you got into obesity care.
Thank you, Nina, for having me. It's an absolute pleasure to be here to talk about our partnership and what we're doing. Fortunate to be one of our co-founders at inHealth, our chief science officer. So I love to talk about the research, all of the evidence. And so to be here on this with you is super exciting. So for me personally, getting into obesity management has been a long-term passion project. And it all rooted in my mom and her personal struggle with obesity. And so I've been fortunate to team up with my co-founders, Aubrey Sawyer, Johnny Jenkins, on this mission. And we started in bariatrics. That's where inHealth was founded. And we, quickly realized that our health coaching services were such a need for providers all over the country. And so what we did and what we're going to talk a lot about today, which I'm really excited about, is how we can bring health coaching, lifestyle therapeutics, lifestyle medicine with body composition alongside all of the wonderful treatment strategies that are out there today for obesity management. So thanks for having me and excited to dig in.
Yeah, well, I think, one of the big things for me is really aligning with other healthcare providers who are, not just like-minded, but have a similar philosophy. And so hearing you speak last year at the Obesity Medicine Association, I knew that we would have to, align on that. And I'm really excited that, we've been talking for the past several months, and we've really determined that this is something that we can kind of be on a journey together to do and add some value to the market. So I thought it would be a great place for you to kind of tell our customers, future and current customers, what health coaching and your services are all about, and then we can kind of let them know what we can bring when we add these two components together with body composition.
Would love to. I think, many of us listening on this call really understand the true impact and how hard it can be to drive behavior change. Let's just be honest, right? People don't like to be told what to do. They need to be empowered to make change. And as hard as that is, so many individuals, ourselves included, are stuck in our ways so many times. And when we have, health conditions and we have our, providers talking to us about ways that we can support our health goals, this is where coaching really fits in so beautifully. It really drives the internal empowerment of behavior change, of what really means for that individual. So intrinsic motivation, using things like motivational interviewing, coactive coaching methods, those are all the things that our coaches are trained in order to deliver alongside the care plan of the providers. And so as we've seen, as we've evolved over the years, it's difficult for healthcare providers to provide all the touch points that are necessary to really drive behavior change. And so one of those things, of course, in obesity management is being able to make lifestyle change related to nutrition, physical activity, mental and emotional well-being, sleep, stress, all of those components that can truly impact somebody's holistic health. Our coaches are there to really help support that. And one of the components that we always, and when we were brick and mortar years ago, we had as part of our office, we had a seca device, and it truly brought the value of how those lifestyle changes came into action by truly seeing how it supported their body composition, evolution, of course, through their journey. So this partnership is really exciting because we're actually bringing those two worlds back together where we originally started. And so, for us, I think this is a really unique partnership and what we can do for, seca providers and other providers as well out there that are thinking about implementing these kinds of services.
I love that. And, to me, I think one of the big components that we hear a lot about from our potential customers or current customers is, okay, I'm bought in, I get body composition, I want to offer it. But how do I pay for it? And that's one of the big driving factors to, we've got to figure out until we get reimbursement for bioimpedance, which, I hope to see in my career, is we've got to figure out how to help people pay for this so that they can offer this, sort of best standard of care to their patients. And I think kind of this partnership really, to me, makes a lot of sense in that we're helping them do something that I'm also very passionate about, which is providing coaching and interdisciplinary care and not just providing, if it's a doctor prescribing medication or, just having surgery, there's a whole host of other components to make that treatment optimized for the patient. And so this sort of brings together, let's do that together. And then also, providers are busy. And so it's not just a return on investment, it's also, who's going to be doing the coaching, because that does take a while. And how do they explain the body composition results? How do they integrate that into their counseling sessions? We can have people who are, trained and know how to do this be the people that deliver that as well. And that's what I think is really cool.
Yeah, I couldn't agree more. And I think to your first point, how this all works on the payment world, one of my, there's a dear friend of mine that always says, no money, no mission. And it's true that if we can't get reimbursement or we can't get an ability for these services to get paid, that's very much a roadblock for many providers and offices that are, let's be honest, struggling with reimbursement these days. And the good news is that the health coaching services that we provide are covered benefits by commercial and Medicare plans. And so we've been doing this for a number of years, started this in brick and mortar 2008, and have continued to use these codes up until when we went to 100% virtual. And so the good news is, yeah, you can see significant reimbursements. Those that attend Obesity Medicine Association conferences, there's several talks on even the codes that we use and how they're leveraged. But the facts are, to your second point, Nina, doctors should be operating at their highest level of coding. And so that's where coaches fit in so nicely. These services can be billed instant to those providers. They can be done through telemedicine or in person. And the revenue is significant. Of course, it depends on region and payer and contracts and all those beautiful things that we love about insurance. But the good news is that it does drive a significant ROI. Because we've been doing this for so long, we do have a very good grasp of what the national averages look like for these codes. The good news is they're increasing year over year when the fee schedules are released. And so what it boils down to is it does drive ROI for the practice. But the bottom line is that patients love it. They see behavior change, and our providers can focus on what they do best, helping to manage the medical conditions. And so our coaches in this partnership, which makes it extremely exciting for us, is they are trained specifically on how to support interpretation of the results. So we've been able to train our coaches to be able to understand and interpret alongside the office, what does this mean for their health journey? What does this mean as they start to see fat mass, decrease and lean body mass change? All of these different components that often take a lot of time in order to drive education and health education. The coaches are there to walk alongside those patients and help them to understand why those metrics are important, what makes them unique for their particular body. If they're using tools like bariatric surgery, how that might be adjusted by, different phases of their post-operative procedure. Lots of things that sort of come into the mix where it can be very cumbersome for an office to be able to field those questions or health education topics. But the coaches are there to do it for you, and it makes a nice little lift away from the office. And, what it all boils down to is a great patient experience. And that's really what it all matters anyways. We want to make sure patients are supported. When they feel supported, they are stickier to the practice. They keep coming back. The office is the hero. The doctor is the hero. And so that's, the beauty of what we're trying to do together is bring this full circle of reimbursement, outcomes, and patient experience to make the office the hero.
I love that. And I think in hearing you say that too, the patient encounters, the intensity and the frequency of that is important. So, we know that it's not just, see the doctor one time, see the dietitian or behavioral health person one time. It's an ongoing relationship, and it matters how frequently you're seeing them. So, you guys are able to do that. You're able to, establish care in the office most often, right, with the physician or the, advanced practice provider, and then connect with you all and see your team virtually. So they're able to sort of maintain that frequency. What is it, weekly, then twice a month, or how does that flow go?
Yeah, you're absolutely right, Nina. The research really drives the need for multiple touch points for behavior change. And how we've organized the program is to match the fee schedules of commercial payers. So, commercial payers will typically reimburse around 26 visits per calendar year. So, you're right. We do follow the evidence that indicates a higher frequency of touch points up front. So, weekly for the first 3 months. The next 3 months is biweekly, and the remaining 6 months would be monthly touch points from the coach. So you can imagine, it starts with a tapered approach in terms of how they are interacting with their coach. With that said, it's very individualized. There's some patients that need more visits up front or spread them out. It really depends on the patient, of course, and the care plan of the provider. But you're right, behavior change is challenging. And so every unique individual is different on their journey. And the coach is able to wrap that around those different touch points around whatever may be the focus of that conversation. Nutrition one time, fitness another, mental and emotional well-being for 7 sessions, and then they loop back around and they talk about purpose or something else, because all of that boils down to how they are implementing lifestyle change for their particular environment or their relationships or all those things that come into play. So that's why the touch points are so important, and why coming up with a strategy together between the patient and the coach is really important, but always looping back around to the care plan of that particular physician or advanced practice provider, because that's really what our clinical coaches have an ear for, right? So they're listening to the patient and their needs, but looping it always back around to, well, let's talk about what's going on with your hypertension. I noticed that you indicated some readings that were a little bit higher than usual. Let's talk. So anyways, there's always a clinical lens to the conversation, and it feels very cohesive in the conversation, which makes it very personalized. So I think that's one point that makes our program unique to others, is that we're always communicating those particular components back to the office. So at the end of every session, those chart notes get back sent to the offices. If they're using insurance, they get coded, applicably to the session that was provided. Those can get billed as any other, billable services in that office is, and that's really the full circle, right? So when the patient meets with the provider, we get the referral. We'll go through the information from the seca device, any other information on the referral, use that information during our sessions, and those pieces get sent back to the office. So that's kind of the full circle and sort of an overview of the patient experience.
And then I think you told me too that you have like monthly meetings together. So it does feel like this is kind of I think you've said like an extension of your care, but it's not just like the providers farming it out and they never really hear back, like just a, referral that you never know what happens to it. I think that's really important too.
It's extremely important. I think that's one of the struggles we hear the most often with providers is, especially in obesity management or even bariatrics specifically, is, if they have a medical weight loss requirement for a pre-op, for pre-op as an example, they send them off to, some other location or another touch point, but they have no recollection of really what's happening during those sessions or during that time. And in this way, the provider is always the center of care. And for us, that's always been a very important factor for us, is keeping the provider in the center of care. So yeah, that's a huge piece that keeps the provider and the office connected to that patient at all times. They feel supported, throughout the entire, journey, for example, in that way. But
So yeah, I envision, folks who've been doing this type of, obesity comprehensive care. This can be a way for them to, add to that, add the frequency and intensity. But for people, I think even more who are just dipping their toe into, maybe prescribing some of the anti-obesity medications is I don't know that they know all that they don't know, right? And for me being in bariatrics for so long, we did have always a focus on interdisciplinary comprehensive care. I think we need to make sure that gets extended to the medication realm where, the patient needs support from all the angles that you've discussed, from all the behavioral contexts. And so, but that's just not doable to have a successful growing practice and to give the patient the time that they need to really attend to their individual concerns. It's hard to do that and grow. So I think that this also supports, doing the right thing, doing the comprehensive care, and also having return on investment, which of course is important for growth.
Right. And so, especially for small practices, small to large, to be honest, but small to large practices that don't have the resources or the ability to have multidisciplinary care, this is really where it becomes a nice support for that office. Or if they just have a roster of patients that, they cannot reach out to or answer questions about, many of those are fielded by coaches, and they're able to drive escalations back to the office if they hear or see anything that's listed on our escalation protocols. So you're absolutely right. The interdisciplinary care is not only important for everyone to support the patient in their journey with their unique specialty, but it's also to help to expand care and to drive more outreach and reach of those offices and the providers reach, because that's quite often a big limitation that's happening in these offices, because they just don't have there's not enough providers out there to be able to tackle the chronic conditions that are in front of us. So if we can support that by multidisciplinary management in that way, it's just going to make the patient experience better, which is going to make the lives of the office better and the provider, all the wonderful things that we hope for.
Yeah. And, for me, it's also exciting. One of the big components of my job is to teach healthcare providers to interpret the results that they get from their seca body comp device. And that's a complicated, it can be complicated if you don't have a ton of time or experience. So it's taking, lots of different data points and kind of putting that all together with how are we going to actually use those pieces of data to integrate into our behavior change counseling. And I think you and I both know as much as we wish everybody were as good at behavior change counseling as we are, that's not the case. And so I really am excited to kind of arm the coaches with more than just weight as one of these outcome measures, right? So,
Yep.
If all they're getting is weight and the patients are hyper focused on that number, but then they're doing all this fabulous coaching and really kind of doing the motivational stuff to keep them moving forward to optimal health, it can be tricky. But now I think we can sort of say, as we know, you're losing weight. Where is it coming from? We want to make sure that you're losing your adipose tissue as much as possible. We know that you might lose lean mass. But how do we give them feedback on that if we don't know? And just using that weight as a number, not only, all the behavioral issues that we have with people, maybe, focusing on that, just from a real utility perspective, we need to have a number that is meaningful to them. And so I think that can really go hand in hand, but also take that burden off the providers who are, again, really busy. We want them to be consistent. We want them to hit all the kind of talking points with the muscle and the fat parameters and all of that. So I'm excited that we'll have consistent feedback, and the ability to have sort of the time and space to address those parameters with each patient.
Yeah, no, I think that, and it's a great addition to their core training with our coaching team. So all of our coaches are board certified coaches, the National Board of Health and Wellness Coaches. And so just note to everybody listening, not all health coaches are created equal. So that's really important to know who these coaches are. Same governing body as the as medical, licensures as well, the National Board of Medical Examiners. So these coaches have a breadth of knowledge, of course, in all those, different dimensions of health. But this component makes it truly unique, right? Using the interpretation of how, the device is impacting their physical health will translate across, the other dimensions of health. And so these coaches are trained specifically to be able to speak to those parameters, answer specific questions, and again, escalate back when needed if there is a concern or a question that is outside of their scope of practice. So, it really helps with the office to alleviate a lot of those questions, give the coach the ammunition that they need in order to help the patient to understand what's going on physiologically. And so that, of course, wraps around their holistic health and what they're discussing for behavior change. So this is truly exciting. I can't wait for us to put this in motion with many offices around the country and see how we can really create this new standard of care. I truly believe it. I know that it is something that is needed in obesity management, but in several other chronic conditions that are out there as well. This is something that I keep saying it truly is a new standard of care that we need to implement. And as we lean into this more, I think your dream, Nina, of getting those bioimpedance, reimbursement codes may come quicker because we just need to show the evidence, right? And so being a researcher, putting my researcher hat on, I mean, that's what gets me excited, is to be able to show the evidence of what we're doing is better, what we're doing needs to be standard, and how this can really impact patient care. So that's how I think this truly moves the needle, not only for the offices and driving ROI and patient outcomes, but in the long term as a new standard of care.
Well, I love that. And on that note, I think I'll let you go. And if anybody has questions or wants to connect with us, what's the best way if they wanted to connect with you first?
Absolutely. So they can email me, mallencar@inHealth Online, or they can go to our website, inhealthonline.com, and fill out a form if you're interested in joining our provider network. We'd love to show you a coaching demo or show you what we have to offer. And so it's a few ways that you can get a hold of us. I'm on LinkedIn and those kinds of things as well if you'd like to chat about any of these discussion topics.
Okay. And if you're already an inHealth customer, we do have special discounting to add on the seca body composition component to that. So if you want to reach out to us first, secambca.com is our website, or you can email me directly at nina.crowley@seca.com. All right.
Thank you,
Well,
Nina.
thanks, Michelle. I'll see you at our next meeting, I hope.
Yes, absolutely. Thanks again for having me.
Thank you so much. Bye-bye.